Welcome to the Mind Body Temple podcast, your healing space with Dr. Rod. The purpose of this podcast is to bring back hope to the patient with chronic pain, anxiety, and depression. Over the past few months, I've brought some messages about chronic pain, anxiety, and depression and how to self-manage our condition. And I've received a series of questions from patients that wanted to share some ideas, some practical ideas about how to manage their conditions more with them. So today I'm going to talk about some practical tricks that you can use in order to manage your condition better. The first question is about how dangerous is it to continue doing exercises if you have chronic pain. The reality is that pain is a blessing to have because when it's acute pain, it's a sign of danger. It tells us that there are some injuries to some part of the tissue in our body that's happening, and the pain signal actually shows to the brain where the injury is happening. But when the pain becomes chronic, then the danger sign becomes a chronic signal of discomfort, which is not very, very helpful for us to pay too much attention to. The reality is that when we have chronic pain, the pain that we perceive is not really a danger sign because after about 3 to 6 months, the chances are that the tissue injury has already healed. It's just a maladaptation of our nervous system that would send pain signals on a constant time frame to the brain. So the brain will perceive this as a danger because it passes through parts of our brain that actually deals with danger signals. So it adds to the signal that is coming from the tissue injury, to the spinal cord, to the brain, all the memories of discomforts that we had, all the adverse memories from childhood to the teenagers to the adulthood. So what comes to the brain, the somatosensory part of the brain and other parts of the brain, are actually the sum of all of these signals. So it's important that we understand that what we are perceiving is not really a sign of danger to the tissue. So that is a signal that we have to remember. That is the conclusion. This understanding will help us to know that it is safe for us to continue what we are doing. It is safe for us to continue doing the exercises, doing the treatments. And I know that the brain wants to prevent difficulties for us, but in reality, if we stop doing activities, we'll lose muscles, we'll lose our energy, the vital energy will go down, and then the depression will kick in, anxiety will become worse because we cannot do the activities that we want to do. And the sum of these factors together will lead into more deterioration of our ability to function. So it is very important that we keep an active focus instead of being focused on the pain. Like the activity focused approach to the pain management is what the evidence-based science tells us is helpful. And the pain focused that will put all the emphasis on the level of the pain is going to lead into less function, and less function will lead into more deterioration of our state of being. Now, the other point that is important is what we can do in order to become more active. Now, we talked about different scenarios in our previous discussions. One of them was the mindfulness meditation. When we are mindful and when we do meditation, we come to the present moment and we bring our awareness to some sort of anchor to the present moment. In many cases, it is breathing. So one of the tricks that you can do as a part of practice, daily practice that I want you to do, is to bring your awareness to the sensations of your breathing and then try to divert that awareness from your breathing to the areas of your pain. You know, usually we try to avoid our attention from the pain. We try to forget about the pain. But in reality, when you put your back or don't pay attention to your enemy, the enemy becomes bigger. When you face your enemy becomes smaller. That's the rule of our mind. So when you face your pain, when you bring your awareness from the sensations of your breathing and you divert it into the areas of your pain and pay attention to the pain as if you're observing an object on a desk without attaching any emotions or judgment to it. Don't love it or don't hate it. Just observe it as keen as you can in order to understand where it is, how the quality of it is, is it pins and needles, is it burning, is it, dull pain, and then what is the level of it, what is the direction of it. And while you are observing it as an object, as objective as you can, then bring the message of safety. Tell yourself that I'm aware of this pain, but I'm safe to continue what I'm doing. So this combined message of safety, when is linked to the sensation and perception of the pain, you're firing neurons that you want to wire with each other, which are the sensation of the pain and also the message of safety. Because normally our brain, the default processing of our nerve pathways are so that we understand or perceive the pain as a danger signal. With these practices, when you bring your awareness to the sensations of your breathing, and then you divert your awareness to the areas of your pain, and you tell yourself that I am safe, you downgrade the pain signal from a danger signal to what it is supposed to be, which is a sensory signal. Do this practice as often as you can during the day or night when you have the pain. Link the sensation of the pain to the message of safety. And the more you do this linkage, the more you will bring down the pain signal into what it's supposed to be, which is a sensory signal instead of being a danger signal. Now, another practice that I want you to do is that starts with an understanding, is know the link between the thought process and your emotional state and your body sensations state. So it's important for us to know that the negative thinking will lead into negative emotions, and negative emotions will lead into negative body sensations. So by changing your mindset, you can change your emotional state, and by changing your emotional state, you can change the body sensations. And pain is a body sensation. How can you change your thought process? Is by catching a negative thought as soon as it comes to the state of awareness. So, remember the rule of 3 C's that we talked about before. The first C is to catch the negative thought. Catch it as soon as it comes to the state of awareness, and then change it to something positive. If something bad happens, don't think that everything is bad. Just catch that negative thought when it tells you, everything about you is bad. No, nothing is true as much as you may think that it's true. These are only, the thought is only a mental happening. It is not the actual truth. We give it the label of truth. So catch the negative thought and then change it, challenge it to, the validity. Know that it's only a mental phenomena and it's not really true. So challenge the validity of the negative thought and then change it to something positive. So catch the negative thought, challenge the validity of the negative thought, and then change it to something positive. You can tell yourself, it's not true that I may think that I'm not good for anything or everything about me is negative. No, there are some things that are negative and there are some things that I'm good at. So for the things that I'm not good at, I can learn how to be better at. So this is the thought process that is changed from a negative thought about everything is bad. You catch the negative thought, you challenge the validity of it. You tell yourself this is not true, and then you change it to something positive, that I can work on things that I don't do well, but over time I can learn to do them better. But this goes both ways. You can also change your body state by doing exercises and relaxation and mindfulness, and then going through better body sensations, you can improve your emotional state. And by improving your emotional state, it will prepare your mind for positive thinking. So it goes both ways, the same way that negative thought can lead into negative emotion can lead into negative body sensations. If you improve your body sensations by being active, by working on active centered pain management, you can improve your emotions. And by improving your emotions, you can improve the state that you can have with positive thinking. So these are the tricks that you can do in order to daily practices. And the more practice you do, the better you can improve your management of pain. Now, through life, you always give credit to others. If a loved one does anything little, you'll give them big encouragement. But we always criticize ourselves and we never give enough credit to ourselves. So it's important that we start to give some credit to ourselves when we do anything good. You have done, if you look at your life, you have done a lot of things despite the adversities. You have achieved a lot despite of adversities. The fact that you are listening to this podcast or video tells me that you are actually resilient enough to be sitting there and listening to this, despite all of the negative thinking that may come to your mind. But you have enough attention and focus to find and seek solutions for your condition. So celebrate every little thing that you do. The fact that you get up in the morning, the fact that you have been courageous enough to seek solutions for your condition and found this podcast and you're listening to it. You go to your doctor, you try to do exercise, you give encouragement to others. So be less critical to yourself. Positive, constructive criticizing is not bad, but don't dwell on negative thinking about yourself. For every little thing, take a piece of paper and write down every little thing that you have done through your life with the adversity that you have. Despite the adversities, you have done a lot and you have achieved a lot. And try to give yourself credit for every little thing that you have done. It's important that you be compassionate and you be caring and you give yourself credit to yourself. That's not a sign of being selfish. When you give yourself credit, you create a scenario that you can grow. And with growth, you can then help others. I love this saying. I saw this first when I was in my medical school. I saw it on the wall. Help to grow and grow to help. So you grow and then you help to grow and then you help others to grow. This way, when you help yourself, you're helping others as well. So all of these may sound difficult to do, but when you do things despite difficulty, there are parts of your brain that actually grow. There are parts of your brain that would create more resilience. Those are parts of your brain that will create more energy and enforce the ability to do more good for yourself. And there are actually those parts that are linked to even living longer and healthier. So all of these things, when you do them despite thinking that, they are difficult, because our brain wants to protect us from difficulty, but despite that feeling, you have to do them. That's the definition of discipline. When you do things despite feeling that they are hard for you, no matter what you do them. So have the discipline of doing these into practice. And the only way they work is if you put them into work by repetition. At our age, you need attention and repetition in order to use your neuroplasticity to manage your condition. So do these practices and I'll bring more practical points to you. Thank you.